almost ready. Bear with
Take your time. I'm here all week. No, I'm kidding. I'm not. I'm teleworking.
You need to lighten up.
I don't know if it'll stay tucked.
All right, I think I'm ready here. So you ready?
Okay. So tell us how you spell your first and your last name.
It's Jennifer Hall, Jennifer Hall.
And tell us what capacity you're working under.
All right, so
What do you do here?
I am the call center lead for Hillsborough County Emergency Management.
So I know tomorrow's going to be starting up for testing for COVID-19 at Ray J. So what do people really need to know? How would they be able to go and get a test if they need one?
Hillsborough County, in partnership with many community partners, including the Department of Health, the City of Tampa, and many healthcare providers, has augmented its call center system in order to pre-screen and pre-register residents for COVID-19 testing. By calling, residents will be able to speak with a specialist who will ask them a series of questions to determine if they meet the criteria for testing. Those residents who meet the criteria for testing will be given a confirmation number as well as instructions for reporting to the drive-through site.
So what are some of the questions? Like if someone calls, like if I'm calling and saying, hey, you know, I'm not feeling very well, like what is it that you guys are going to be asking of the people who are calling?
Only those individuals who present, let me start that over. Only those individuals who are experiencing COVID-19 symptoms, which are fever, cough, and shortness of breath, will be able to be screened through this process. Additional questions that will be asked in this process have to do with whether the person had contact with a confirmed COVID-19 case, as well as other risk factors. I didn't like that either.
Fix your hair too.
It's like,
Yeah.
So she's just asking, like, when they call in, what happens? Like, where do they go first? What do we ask them? Then how do they get down the line?
okay. When residents call us at 272-5900, they will be asked to press an option for questions about COVID-19 coronavirus. When the call is answered, they will be asked if they are experiencing symptoms of coronavirus, which are fever, cough, and shortness of breath. If they do have those symptoms and they are asking to participate in the community drive-through testing, then they will be connected with a specialist who's housed here at the community. Oh my God, this is making it worse.
You're doing great. You're doing great.
All right, I'm gonna try to start over so you can get like a full.
No, it's, I mean, even if you like just
explain it to me like we're just talking.
Yeah,
Forget about the
we're
cameras.
Just
Just like
having
what?
a conversation.
How do you get in the line? Yeah.
Yeah.
How do you get in the line?
Yeah.
All right.
So if I was one of the people that was calling, I mean, how are you going to walk me through exactly what I need to know to get to the site?
All right.
And pretend like you're just having a conversation
Yeah.
with her. Just you and her talking about it.
Okay. If you're experiencing symptoms of coronavirus COVID-19, which would be fever, cough, or shortness of breath, you can call 272-5900 and select the option to speak with a specialist about coronavirus. That specialist will verify that you are symptomatic and would like to participate in the community drive-through testing. They'll connect you with another specialist who will then ask a series of specific questions around what kind of travel you have had, as well as any symptoms you may be experiencing, any risk factors you may have, such as being immunocompromised, as well as any contact you may have had with a person who has been tested and proven to have coronavirus.
Have you guys had any calls today?
We have had calls today. The last interval I checked was a 2-hour period, and in that period there were 69 calls.
How are people sounding on the phone when you are talking to them?
I actually don't have that information.
Is there? I guess I'm trying to think about the staffing. Like how what are you guys doing to kind of make sure that the call center has enough people to answer the calls just in case you guys get bombarded tomorrow?
We're evaluating the call center stats on an ongoing basis, so we're able to see how many calls are coming into the line, how many of those calls are being answered. So we have an answer rate of 92% right now. And that's telling us that the number of people we have staffing the call center is appropriate for the number of calls. That's a good standard to go by, is 92%.
Is there anything that you guys are maybe thinking about to, or I guess, is tomorrow going to be like a trial run to see what may need to change, if anything?
We're constantly evaluating the process to see if there's anything that we need to change in terms of how we're handling calls or how we're directing callers to make sure that we're optimizing the process and making it as efficient and effective as possible.
So people basically have an appointment if they qualify and meet your criteria through the hotline. Will they get an appointment, a time to show up? Explain how that works.
Yeah. Those people who do meet the criteria for testing will be given a confirmation number and a date and time to show up at the drive-through site. That will be required in order to even show up at the drive-through site for testing.
Is it possible that that could be the same day? Like, or if someone calls and says, hey, I'm feeling really bad, I have all these symptoms, would they then be able to get tested that same day?
I don't really want to speak to that. It's a little bit outside of my area of expertise. The call center providers are the ones who are answering that. Basically, they have 5 days that they're designating. I think it's 5, don't quote me on that, days for testing. And people are allowed to choose a date and time unless that date and time fills up.
Do you know how many test kits you have available now? And if you do know that number or don't know that number, are you requesting more or are some more coming? What have you been told?
I'm sorry, I don't have that information.
You don't know how many tests you're going to be able to perform tomorrow?
No, because she's just call center.
No,
Yeah.
sorry. I'm not the subject matter expert for that.
Okay.
And so tomorrow starts the testing, starts when people will be able to kind of, I guess, call and schedule an appointment. Is this kind of from now until whenever this ends, or is there, because I know you said there's like approximately 5 days when they would be able to get an appointment. So I guess, is there like a schedule or any sort of hours when this will be running?
Right now, we're looking at doing about 200 tests per day at the sites. And once those slots fill up, we would be looking at the next day that has open slots for testing.
And that number was given to us by the healthcare providers, just knowing how many they're going to be able to administer at a certain given time. Is that correct?
That's correct.
Yes. Can you say that?
Yeah.
So that this time that's our decision.
That number was provided to us by the providers who are delivering the testing at the site. It is subject to change, but it is what the plan is for now.
When did the hotline start? Today?
Today at 9 a.m.
And the hours of it? The hours of operation?
Hours ongoing from today will be 8 a.m. to 5 p.m. We can take general questions 24/7, but to speak with a specialist in order to be scheduled for drive-through testing, callers will need to call during the 8 a.m. to 5 p.m. time frame.
Okay, so when people are calling, they're gonna, and I guess I'm trying to figure out like who's actually going to be screening them. So you guys have not only people who are answering the phones who are with the county, but you're also having doctors who are there who are gonna kind of, I guess, do that pre-screening process.
Healthcare professionals.
Healthcare professionals, I would say, they're not all clinicians, but they are trained to do this process specifically. There are a series of specific questions that each one will ask.
Did you talk about the volume so far today? You were telling me how many appointments we've made so far. It seemed like a decent number for tomorrow.
Right.
But 46 appointments if we had 200 slots. Still feels kind of light, or?
Right. We just put the information out. People are still getting a hold of that information and making those calls, and calls have ramped up throughout the day. I expect that to continue until all the appointments are taken.
And so far, how many appointments have you guys had?
As of 3 o'clock, we had 47 appointments.
Will you keep booking past the 200? So if you reach 200 today, will you go ahead and book for the next day and the next day?
I believe that's how the scheduling process will work, but that will be up to the providers who are managing the actual scheduling piece.
And what area is this site going to be covering as far as like residents who are watching this? Is this just for Hillsborough County residents?
I actually don't have that information. I don't know if they're going to be requiring ID or anything like that. It hasn't been part of the conversation that I've been helping to frame.
The testing site's going to be at Raymond James?
Correct. I don't know if I did a very good job, but
It's all I get it down